Hello doctors, welcome. Today's topic of discussion is going to be water blockage through your ultrasonic scaler. Now this technique is going to be helpful to you when you have an inbuilt dental scaler, or else if you have an external scaler, you can also use the same method to get your water flow going on. Now one of the major fault for water blockage in a scaler can be some debris, dust particle, which can be easily avoided by using distilled water. We have already created an excellent video on distilled water and dental clinic. Please go through that video. But even though after using the best quality distilled water, sometimes you might encounter blockage of water or no water flow out of your dental scaler. Recently I had a same problem with one of my scalers at one of my clinic, and I found it to be a good opportunity to let you all know how do I solve that problem. Okay, so furthers are going to be all the steps, starting from opening the working tray table, that is my dental chair's circuit area. I will also give you a brief idea what does a dental chair under the working tray has. Okay, so this will give you a brief idea. Now different chair companies will have different locations of some of the other circuits, etc., but the main purpose or the major components will be similar. Okay, I'll give you some tricks also how I avoid further damages to my dental chair and what precautions needs to be taken. All the doctors who are going to get new dental chairs, they can take guidance from some of the tricks like covering your circuits with a plastic bag. So by chance if you have water leakage in nearby pipes, then the circuits don't get damaged. Okay, so it is going to be a very informative video. Okay, stay tuned to the video. Okay, and also please remember, these are DIY videos and these are also an educational videos. Okay, so I cannot make this interesting. These are not for entertainment. Also, if you keep on skipping the videos, you will lose or miss some of the other important point. Okay, this is one of the major problem with our current generation, where we are trained to watch only those 30 seconds YouTube shorts, and then we need a more dopamine release. So whenever the video becomes longer, we try to skip it. But please remember, this is not for entertainment. It can help you out when many a times your repair guy is not coming to you and you want your scalers to be functioning appropriately. Okay, so this is going to be a DIY video. Please go through the complete video so that we will have less queries from you. Most of the time people have so many questions regarding it, and every time our answers are going to be, please go through the video again in detail. We have discussed everything. We give a lot of efforts to make the video completely self-explanatory, and we try to cover as many points as possible. So please make sure you are attentive to the video. Okay, and number of queries from your side are less about things we have already covered. Yes, definitely nobody is perfect. Sometimes few things we might feel are very simpler, but somebody might have a genuine questions, or we might have made an error and mistaken about discussing them also. So if some things like that happen, feel free to contact us. Our contact details are in the description box. Okay, and we'll be more than happy to help you out. Okay, so doctors, once again, I am Dr. Tarun Mavadia from the Aksar Dental Academy. Let's begin. So doctors, as you can see on your screen, here is a visual of our scaler connector, where by pressing the foot pad, no water flow was coming. I checked it at the connector point, I checked it at my metal tip point, and it was not coming. Also, another problem with a scaler can be overflowing of water. Now this is going to be a separate topic, where this also can be one of the solution, but before that there is another solution. We will discuss it in the next video. Coming back to our point, here we are trying to solve no water flow or water blockage from our scaler. Okay, so here I have opened up my working tray table, which is just below my instrument tray. Okay, and I would open up the screw at the base. Here you can see two of my assistants are helping me out. It is always important, whenever you open this tray, you need at least one helping hand. I have opened up some connections which will help me to open my tray wider. Now here is just a brief idea about what are the components inside my dental chair. It will be almost similar in your chair too. Okay, so previously was my main circuit. Here you can see a scaler, and on the corner side these are connections. I'll come back to all these components separately again. Here is what you can see, the solenoid which we are going to repair for our water flow blockage. Okay, and these are some of the connections for our scaler and our air rotors. On this corner are the two solenoids which are controlling the water supply to your air rotor. Okay, in few upcoming videos we'll also solve this problem whenever water blockage is to your air rotor, how to solve it. Okay, so here is a close-up look. This is the main circuit of my dental chair. Okay, as you can see, I have covered it with a plastic bag so that there are so many tubings nearby, and if there is a puncture with pressure, then water can easily go over there. So I'll try to protect it. This is what you are seeing is my woodpecker scaler. Okay, it is an internal scaler. Here are corners are the controllers. Okay, here a central hole is where all the tubings and the current comes from the base of my dental chair and enters over here, and then you can see the water and the air pipings are attached over here and they get distributed. These are the side water controllers, scaler speed controllers, and air rotor management connections. Okay, and from there water and air is transferred everywhere. These are my below connections. The first one is for my scaler, the middle two are for my air rotor, and the third one, okay, this is for my air rotor. Okay, here you can see water tubing is the thinner one and the bigger one is air tubing. This is second air rotor, and this is my three-way syringe. These are the two solenoids that control the water flow to your air rotor, and we will try to repair this next time. Okay, currently coming back to our point, so our main reason for water blockage is this is also called as solenoid for our scaler. This will be similar in your external scaler also. So if you don't have an internal scaler and if you have an external scaler, you will have the same thing. Here you can see the solenoid was connected to my scaler circuit. I have removed that connection. Okay, now here is a very important trick, and which I follow every time. Whenever you open up something especially related to circuits and dental chairs, try to mark them and also click pictures or record videos. Okay, so here you can see there are two tubings, so I'm marking one side of the tubing. Okay, and I already have a video for it, so what was connected where and how becomes well known to us. Okay, and now I have removed the electrical current. Okay, please make sure that your dental chair is off. Okay, this is definitely applied to it. Okay, and now I have removed the connection from it and I'm trying to remove the tubings from my solenoid. Okay, so here you can see there is an extra protective over tubing on top to make the connection tight. Okay, so same thing I will be doing on the other side. Here I have removed the topmost protective sleeve first. Okay, and now the main tubing on the other side. Okay, so here our solenoid is detached from our dental chair. Make sure that your water supply, air supply, and also your electric supply are off from the dental chair. Okay, now here I'm trying to open up the solenoid. Basically it has two components. Number one component is the electric component, that is the plastic black color on top, and there is another brass component at the bottommost part from where the water flows. Okay, I'll show you what is this solenoid and what is the main mechanism of it once we will open it completely, so you'll get a better idea. Okay, as you can see, I open up the topmost screw and there is a small visor to connect it. Okay, now I'm going to separate this. Okay, there is a what you can two-way tape at the back to keep it attached to the base of my tray. That's all, no major significance. So here this is the electrical component which is out. Now here is our main piston or our brass component. Okay, and as I'll open it up, I'll show you how it works. Okay, so I will need a small 4-part screwdriver to open it up, and here we are going to open it up. Okay, there are two screws given on top. We will open them one after the another, and now you will come to know how does this function. Okay, so basically their solenoids can be of multiple types, and how they function is electric current passes through them. Okay, and when electric currents passes through them, there is a piston in between. Here you can see this sort of a piston which will rise up due to magnetic field and fall down when it is off. Okay, so now here as I open this up, you will be able to see the piston inside. Okay, so here the topmost ring is out, and now our main cylinder on the top, the brass one, will come out, and there will be a cylinder with a spring inside. Okay, so here is our cylinder and the spring, and here is where it controls the water flow. Okay, so now the main assemblies, you can see there is lot of scales accumulated, and this will affect the movement of the piston, and it was blocking our water supply. Okay, so we will definitely clean all of these things. Okay, but first let me explain you what this solenoid is and how it functions. So here you can see, here is the piston which moves up and down when the electric current passes, and the spring helps it. You can see here it is how it presses the switch below, and water flow is activated. Okay, so this is how it works, and on top you have that black electric component which where the current will pass, it will generate electric field and pull it back, and when it will, the water flow will start, and when the current is not passing, the piston will fall down and water flow will stop. Okay, so this is how it functions. Okay, when you activate it, the magnetic field comes and the piston goes up. Okay, and when you deactivate it, the piston falls down and the water supply is blocked. Okay, many a times there can be large amount of scales you will be able to see, and which will affect the magnetic field, and the piston will not rise up much, and that leads to water blockage. Basically there is no blockage, but the piston is not lifting, that is why water is not coming out. Okay, so here you can see I've taken a cotton piece with my sterilium, and we will try to clean it. Okay, so to make the scales more visible, I'm trying to clean the first dust particles, okay, with an alcohol swab, or any type of alcohol or a sterilium will do. You need some sort of a metal instrument to scrape it out. Okay, I'm just trying to see whether this has corroded or it actually comes out. I found it was coming out, so here you can see I have taken my old wax knife and I'm trying to scrape it. There is a rubber visor on top. Make sure you are not damaging it up. I have done these repairs multiple point of time, so I am aware how to do it. But if you are new to repairs, make sure to remove that rubber visor and then clean it, so that you don't cut the rubber visor. Okay, if you do it carefully, here you can see I'm not using a very sharp wax knife. It is little bit of a blunt type, and that is what we want. Basically friction is what will remove all the scales. This is not a major reason for the piston to get blocked, but still we have opened it up. Whatever is visible to us, better to clean it. Okay, so here I am trying to scrap as much of it as possible. You can see at the base also there is, because it is brass, it has corroded little bit. Okay, but whatever can be scrapped out, we are trying to scrap it out. You can try out blade also. I did not wanted to damage the rubber tubing, so I did not try out a sharp blade. Okay, you can scrap it like this, so that's why I avoided it. Okay, now comes our water supply assembly. Here you can see there are some amount of scales on side. Okay, and we will try to dry it also. So you can use cotton or you can use tissue paper. Okay, when it comes to drying and cleaning, I prefer tissue paper. When I want to clean it with an alcohol swab, I prefer cotton. Okay, so now here as I will scrap on the area, you will realize there will be some or the other type of scales coming out. Okay, and you basically need to scrap it. So here you are able to see that a lot of these scales are coming out. These are a partial reason for it, but the scales will be deposited on the piston, and it will affect the magnetic current to rise the piston up, and that is the main reason for it. Okay, but still, since we have opened it up, better to clean as many scales as possible. Okay, these scales are like our dental tartar and plaque and tartar. When they start with a very small quantity and suddenly increase. Okay, so you don't take them lightly and you clean as much as possible. You can try out different angles and different methods. Okay, and just scrap it out. Be careful, do not injure yourself. Okay, by doing these repairs, if you injure yourself and cut yourself and then you're not able to work for one day, it will be a major loss. Okay, so that is why I'm using blunt instrument, so even though accidentally I don't cut myself. Okay, so be very careful while doing this. Not a major rocket science, but just a small friendly warning from our side. I'm trying to dry it out. Okay, and clean it up. If you are not using distilled water, there can be some dust particles and blockages over here too. Okay, but it will be a bad idea not to use distilled water with your dental chair. Okay, please remember, your RO water or drinking water, AquaGuard water will not work. Why? What is the reason for it? We have explained it in the video of our distilled water and dental chair or dental clinic. Please go through it. Okay, this, now we come at the main culprit why the water is not coming out. It is because of these scales. You can see a light gray color materials on the surface, and I'm trying to scrap it up. Because of the reflection of light, it might not be clearly visible. I will try to focus it and make it visible to you. You can see some amount of white powder on my fingertips. Okay, so those are the things that are happening. Okay, and this is the main reason for it to happen. Now here the number of scales are not that much. Okay, and there is a rubber there is a spring attached. You can remove it altogether, but my attention was more towards recording things appropriately and cleaning it up. In that, I did not remove the spring initially because I was able to clean it, but I'll show you how to remove the spring also. Okay, so I'm just scraping all the things up, and you can see lot of scales coming out, and they are getting attached to my wax knife also. Okay, so spirit will not do much of a cleaning. You will have to basically scrap it. Okay, now it came to my attention that I have to remove the ring. Okay, so now here I will show you how to remove the spring is little bit smaller from one side. Okay, so you have to remove it. Okay, now here the complete spring is out. I think you will be able to clearly see the scales now everywhere, and that is what affects your magnetic field creation. Okay, so and you just scrap it around. Okay, and remove it. You can also dip this into vinegar, but it will take some time to remove it, and vinegar will have little bit of effect on any rubber visors given. So I would like to just scrap it and clean it. Okay, and it will do the same purpose. So now here, just to show you that the spring is smaller from one side, it will not enter. It has to go in a particular manner. So here is how it goes, and it needs to get attached over here. So our spring is back again on our piston for our solenoid. Okay, it will go inside this cylinder for our piston. Okay, and here we are going to get it attached. We are now on our work to close the solenoid. Okay, I was able to find some stains over here, but they were just mild corrosions, nothing to worry much. Okay, so again I'm reassembling all the components, and we are trying to close our solenoid again, and hopefully it functions well. So I've tried to tighten the screws on both the sides. Now we are attaching the magnetic piston. Okay, it is just going to pass current, so does not matter on which side it is. Okay, but still I already had a picture from previous, so I watched it and placed it on the same side. Here is the visor and the green knob. Previously I also opened it up. You can see I've done a green gel pen marking on top, so I know it is on the top. Okay, I try to record everything and mark everything, so everything has to be accurate like the company gave, and we can have a better success. Okay, so I'm trying to tighten it gently. Okay, and our solenoid is cleaned and ready to get set back again. I have already done some markings earlierly, so now our refitting becomes easier. I will just try to push the extra supportive tubing on top. Okay, that is just to give an extra support. So I'll try to pull it back, and we will first attach the inner tubing and then the top first one. Okay, so here we are now ready, attaching towards the marking side. Okay, if these connections are little bit weaker or broken, you can cut it with a scissor and then attach a fresh tube over there. Okay, but here my connections were not that much weaker, that the plastic was still of good integrated quality, so I did not cut them. Okay, now trying to connect the second side. Okay, so here I'm again putting the protective sleeve inside, and we will connect it towards the other end of our solenoid. Okay, so our solenoid is connected. Now I'm attaching it to our circuit of our inbuilt scaler. Okay, please remember our water flow, air flow, and our current is off. Okay, so now I'm again covering it up with the bag. We will, our assembly is confirmed, we are just rechecking the fitting, and now we will connect anything that was removed. Okay, so here this is the connection that was removed earlierly, and we'll do a final check, nothing is out. Okay, and we will close our tray. Right now we are not going to screw it up and see. So this is again the previous video or previous situation where no water flow was coming, and you can see some amount of linings or scrapings happening. It means that a scaler is on but water flow is not coming. Now after our repair and after some times, the water flow is back. Okay, so immediately water flow will not come. Please remember, water has to again refill all the tubings and then come out. So immediately when you press after this repair, water will not come out at the same moment. Try to wait for 5 to 10 seconds and water flow will definitely appear back. Okay, so doctors, I hope this helps you out, and next time whenever you have blockage of water or no water coming out through your dental scaler, okay, first and foremost please check that your distilled water supply bottle, the knob is on. If that is on, then you should have an understanding that are you using a good quality distilled water. If you are doing that, then this can be only the reason for no water flow coming out of your scaler. Okay, my further plannings are also to engage you and inform you about how to manage no water flow coming out of aerator. Okay, we'll also try to see when the water leaks more from your scalers and from your aerators, what can be a reason for that. Okay, step by step we'll try to cover each and every point similar to this. Okay, our aim through this DIY videos is to help out the dentist be self-sufficient, and every time you don't have to wait for a dental technician. Yes, if dental technicians are available to you and if you have multiple chairs, it will be a good idea to call them. But if you are aware about it, you at least know that nobody can cheat you out. Many a times this can happen. Okay, so this is just to make you aware about your dental chair. You should be aware what is inside your dental chair. Okay, and you should know how to repair them if needed, but you should have an idea. Many a times female dentists will feel that no, I cannot do such types of repair. It's okay, but at least have a knowledge, so you know what is a solenoid. Okay, if you know what is a solenoid, you know it can cost you anywhere under 1,000 rupees. So nobody will charge you 5,000 rupees for this. Nobody can tell you. Also, looking at the video, you got an additional information that whenever you open up your chair or whenever you're getting your dental chair fixed up, try to get the circuits covered with a plastic bag. Okay, you can see there were so many tubings running around the circuit. If there is a small puncture anywhere over there, if it is through air, it's okay, but if it is through the water tubing, then anywhere the water can reach to your circuits, and then it can be a major problem, and mostly the circuits cannot be repaired. You will have to get a new circuit. It is an expensive affair. Okay, and why to do such things? Okay, so looking at such videos, even though you are not going to do them, they can help you in many other additional informative things. Okay, and that is what is our aim is. Okay, so that's all from me on this topic, doctors. I hope this helps you out. Still, if you come across such issues and you find these solutions not working appropriately for you, or else you are not sure whether you've done things right, be part of our We the Dentist community, where we try to help out dentists from all over the world with common problems which are not written in books and which are practical problems for every dental clinic. Okay, so details of our WhatsApp group is given in the description box. Please remember, doctors, this is not some ordinary dental group. Okay, you will have to verify yourself as a dentist. So as soon as you will send us a request through this link, Okay, within next 24 hours you will get a message from my personal number. Okay, and you will have to verify yourself as a dentist either with your dental degree certificate or your provisional certificate, and also either your final year mark sheet. We need at least two proof. Many a times doctors give us their registration number. It is very easy to find registration number. Sometimes doctor will give us just their visiting card. I can give you 1,000 visiting cards. Remember, these security features are to keep unwanted people and spammers out of our group. Okay, each and every one of us are in at least 10 dental groups. Okay, when the dental groups are created, they are active and then they lose their charm. We are not like that. Our group is only for question and answer based dentistry. Okay, so you can get answers for it. Yes, in our group we have a bigger community. There is a separate group for forwarded messages and for fun. There is a separate group for people who are about to start their clinic, separate group for people who are practicing dentistry for 2 years, separate group for students. Okay, but our main group with a dentist, it functions on question and answer only. Okay, there is no other activities or time pass over there, and no forwarded messages are allowed. Okay, so if you want to be part of our community, yes, we have one very good group on best deals on dental products. We try to bring out some genuine products and some very good deals for you. Some of the very recent deals we got on 3D Master Shade Guide. Very soon we are coming up with our own RVG holders. Okay, and also we are trying to solve out the problem of illumination. Basically the dentistry has evolved a lot, and now magnification dentistry is up to trend right now. Loops have become economical, but still they are little bit expensive for many of us. Okay, I have started using loops. It was again one of my major regrets that why did not I do this earlier. But earlierly they were very expensive. Now they are somewhere in the practical brackets. Okay, so I would like to motivate everybody, but everyone I know is not going to spend that much money immediately. So I want to motivate you by giving you first step to it, and that is illumination. If you can look at it with your naked eye, then you might understand the importance of magnification and illumination. So we are trying to solve the problem of illumination, and we'll have an excellent light product. Okay, headlight, which will solve out the problem for you, and like always it is not going to be that much expensive. Okay, so we are going to solve that out. Okay, and we are also trying to work out on a deal for special denture trays. Okay, we already got them imported for our general dentistry batch and our denture batch. Okay, but for our We the Dentist community, and some of my friends also wanted it, so we are trying to get them. Okay, so there are so many such activities we go through. Be part of We the Dentist community. And yes, again January is coming. Like every year we are going to conduct our free composite master course, where we can guarantee we will change your composites for life, and we can assure you will be able to earn more money out of composites. Okay, why do we conduct this course for free? Okay, number one thing is, when I started my clinic, okay, basic dental treatments were extraction, scaling, composite was fancy one, ceramic crowns, zirconia were not yet introduced much, or were not that much in a price bracket. So these were the fancy treatment we had. Okay, and whatever patient got a root canal done, I was trying to explain them to get composites done, but my composites were not so much great with what you can call improper knowledge, like every one of us from our college. I was facing problems with composite, but I realized that this is not going to work for life. So luckily I was able to find some good mentors, and joining so many courses I was able to solve my composite problems. Important point is, by solving my composite problems I was able to make a lot of money, or sufficient amount of, or large chunk of money through it. Okay, so I want to impart that knowledge back to everybody. Okay, and as for a freshly passed out dentist, you should be master at general dentistry first, and you can have that better taste of earning premium through composites. If you are charging 500, 1000, 1500 for composites, and through our course if you learn good quality composite filling, and if you charge 2500, 3500 for good posterior composites, anterior composites 4500, 3500, or even more, Okay, then once you will taste, it is like giving blood to a lion. Okay, once the lion will have the taste of blood, then they cannot go back. Similarly, once you will have a taste of doing premium treatments, getting good satisfaction from patient, okay, feeling proud about yourself that I showed my skills and really, and patients appreciate it, the doctor, you've done an excellent job. Nobody can make out that this is a feeling. And also when patient pays you premium, then you understand importance of education. Okay, you can spend 5 to 10 years and spoil some cases and then do an excellent composite filling. You can take a smarter decision and join some good course and do it. I also do the same thing. I also have learned full mouth rehab by joining many courses together. I am a curious guy and I know that no one person cannot solve anything. So I have to join 2 3 courses of FMR to learn everything out. And I'm a curious one. Okay, very recently my philosophy has changed, that but I'm blessed by God also that I can afford it. So I feel that by paying somebody 40 50,000 rupees, if I can learn what they do in their last 10 years of their practice, it is a good deal for me. So I do that. So I've done the same thing for implants also. I have done same thing for my microscopic journey also. I've done same thing for my loops learning also. Okay, I've done same thing for learning what you can call Photoshop, smile design editing also. Okay, so everything that I've learned, I've joined multiple courses, and with the help of that only I'm able to earn more. Okay, so I want you all to understand, in dentistry the technology upgradation is very fast. You have to keep up to it. If you are having problems with composites only, when are you going to reach to do implants and those smile designs? And the world is so much far away. Okay, so a small part from my side to motivate you, that's all. So be a part of our composite course in January. Details will come very soon in the channel and in our WhatsApp group also. But yes, you will have to be part of our WhatsApp group so that we will share the classroom IDs over there. Okay, so that's all from me on this topic, doctors. Description of our WhatsApp group and other activities are in the description box. Always try to form a habit of watching or have a look at our description box. You might come across something interesting. Okay, so that's all from me on this topic. See you all in yet another interesting video. Until then, stay tuned to the channel.